Dr.
Yeah.
Ravi Kumar, it's very good that the doctors have called off the strike, because we saw in West Bengal that they have not done so. And, the patients were suffering. But of course, I am all for doctors. Let me stick my neck out, because if you ill-treat them, then you'll have to face the consequences. Are you satisfied, Dr. Ravi Kumar, with the conditions that you have placed, and you have kind of some kind of a trust and faith on the government that all those conditions will be fulfilled, doctor?
These type of stories has been going on for many years.
Yeah.
We have been going in for class strikes, and we used to ask for the demands, and they assured that they will give proper things and settle all those demands. And you all know, doctors will be very busy going on to see the patients, and they will be in the routine, and the things just like that go off, and another incident comes, and such things go on and off across the country. So what we would say is, whatever demands we put, that is different, and whatever the law and everything which comes, that is different. But my humble request to the entire public and the entire nation is that no doctor is going to kill a patient. No doctor wants to ill-treat a patient. Certain basic things the public should understand, that no two patients will present with the same type of problem for a same disease. That basic thing they should understand.
Yes, sir.
And the treatment, the response to the treatment is not the same with all the patients for the disease. So each and every patient is a different situation, and they present to us. And we do our maximum best how we could save the patient or how we could treat the patient. So in this condition, the incidents which occurred is a stage 4 cancer patient. That is 4th stage of cancer patient, it's an advanced cancer patient. And whoever is going to treat that patient, you cannot save that patient. The complications which are ought to occur will occur for such patients.
Right.
These awareness are not
Yeah, but
being.
Dr. Ravi Kumar, I'm sorry to interject, but
Yes.
requesting is not helping really, because we saw even in Stanley Medical, of course, that person allegedly was mentally upset, and I'm not going to sit on judgment. But this is not the first time. It happened in Kerala a couple of months back, where a young doctor intern was stabbed. This man was brought in, he stabbed her. That's it, life gone.
Yes.
This 31-year-old
That's
intern
it.
in Kolkata, dead. What happens to her life? I mean, if she had been alive, she could have done so much of service. The problem is rate of convictions. What is the Tamil Nadu government going to
Yes.
do? Have they said
Don't think.
all that Ma Subramanian said, oh, I'll put CCTV, police post, I'll give a triage tag and also identity cards. Is this enough? Because unless the
This is
law
not
is
enough.
empowered, it's not enough, doctor. I may have an identity.
Yeah.
How
Yes,
come a
that's what.
man enters a government hospital with a knife, doctor, you tell me?
Yeah, that's what I was about to come to you to tell to you, that two things has to be done. One is the government should come forward to create awareness to the public. That is one. Second thing is they should announce the hospital zone as the safe zone. Safe zone is protected zone, like what the airport is like. The airport, can anyone enter into the airport? Just like that. So similar such of situation has to be given to the hospital. That it should come as a legislation. That is what we are fighting for, and we are asking for that. Unless that comes, we cannot get any solution for
All
these
right.
things.
Okay.
And
All right.
yeah,
Let me also welcome the other guest, Dr. Vignesh Rajendran, President of TNRDA. Dr. Rajendran, a very warm welcome to you. What kind of assurances have you got from the government, doctor? So that
Ma'am,
you're
right.
ending the strike tomorrow.
Yeah, so right now we have just got oral assurances from the Chief Minister and Health Minister that they will revamp the security measures, but these are just hearsay and these are just oral assurances. We are still waiting with bated breath for actual return legislation, because from what we can note is the fact that these incidents keep occurring in each and every part of the country, not just restricted to Tamil Nadu. The shocking incident that occurred in RG Medical College in Calcutta 3 months back shocked the entire nation. And we really thought the central government will put their put their foot down and create a strong Central Health Protection Act, which we were all screaming for. But the CHPA has still not materialized, and that has snowballed into this, because the attenders are always going to be emotional, and such incidents are always going to be occurring. So it is completely up to the state government and the health minister of each state to ensure our protection. Because at the end of the day, we cannot be losing our lives, saving other people's lives. So from our side, what we have requested the government is to ensure that the number of attenders per patient is reduced in every hospital. And every attender before entering the hospital premises has to undergo a proper security check-in, like how it happens in cinema theaters and airports, because our lives are important too. And each and every attender has to has to carry a security or a visitor's pass and undergo a proper scrutiny and pat down also if they must. And then only should they be allowed to enter the hospital premises. And all these have to be brought into written legislation as soon as
Yeah,
possible.
fine. Yeah.
Because
But are you, doctor, tomorrow ending the strike as you've given the word? Because I heard from Dr. Senthil, who was on the show yesterday, and he said that, ma'am, we are ending it tomorrow. Is that right? Or you're waiting for, like you said, oral assurances have come. Is that enough for you to end the strike tomorrow, Dr. Vignesh?
But unlike the government in West Bengal, the government in Tamil Nadu right now is more receptive to the doctors, and we have decided to trust the government's words as of now. But we have also promised our residents and our fellow colleagues that if these oral assurances do not materialize into actual written legislation within the next week, we will be escalating this further. We have decided to call off the strike temporarily, but we will still continue to hold sit-in dharnas and demonstrations and silent rallies till actual written legislation comes into play. But the strike stands to be called off as of now because the health minister and the chief minister and the deputy CM, all three have promised us very clearly that they will take this up seriously and they will make this actual return law within the next week. So we are waiting for that.
All right, Dr. Ravi Kumar, I want to ask you that legislation is going to take a long time. It's not like you snap the finger and legislation happens. I mean, this seems like
Not like
a,
that.
this seems, doesn't seem like a war, it seems like a battle.
Already we have a very good Paka Act that is called the Act 48 of 2008. This Act 48 of 2008, what it says that if a patient makes a noise inside, that is enough to arrest him under non-bailable offense. So anything, if even if he just enters into the hospital and makes a noise, and if he prevents the doctor from or the healthcare professionals from seeing the other patient doing his duty, he can be arrested under non-bailable offense. If this act, which is in existence, can be made stringent, and if it is properly followed, we will succeed it. That itself is not being done. And I am sorry to say that even the higher officials of police officials doesn't know about the Act 48 of 2008 unless we go and represent to them every moment. And even if we represent, they don't book the patients, book the culprits under this act. So what we want is, we want two things. One is Act 48 of 2008 has to be implemented stringently, and it should be made aware to all the police officials and the public, to make it aware that such a stringent act is there and they cannot make any noise inside the hospital. So if that
Yeah.
can be
Yeah.
done and that can be implemented, we can succeed everything.
But the
That
question is, Dr. Ravi Kumar, why was it not done? Dr. Vignesh, this man, the assailant, enters the room when oncologist Dr. Balaji is taking rounds and he is on duty. Apparently, he shuts the door and then stabs him allegedly several times. What was security doing at that time?
You explaining in graphic detail is all the more horrifying, and the picture of a doctor, sitting casually in his OPD and taking care of his services and being stabbed multiple times, 7 times over his head and neck by his patient's attender is shocking. The question that arises here is why the government and why the nation per se always tilts the argument in favor of the patients over the doctors. Is it because we doctors are always meant to serve people without thinking about our lives? It is principally because of the fact that patients are always going to be sick, and the attenders of the patients are always going to be emotional. So because they're emotional, these crimes are always labeled as emotional crimes, and the government and the police officials always come behind us after the crime has occurred and request us, in fact beg us to call off the charges and to clear the police files and not to initiate action against them. Of course, those are all minor incidents, but when somebody is making an attempt on the life of another human being, this has to be treated as category one murder. This is just an attempt of murder, and this should not be let off, easily. And we are all angry at the government for letting this off the hook so easily. And we have promised the family of the assaulted doctor that we, on behalf of TNRDA, will make sure that the police officials of Tamil Nadu file a non-cognizable and non-bailable offense against this particular individual, because this individual who stabbed Mr. Balaji was completely in the senses. He had no psychiatric issues. He was emotionally charged, yes, but otherwise all his psychiatric senses were completely intact. And if you see the video where he is walking, carelessly into the corridor after stabbing the doctor, it literally sends shivers and chills down our spine. This can happen to anyone, which makes it all the more important to make sure that he is put behind bars. And as Mr. Ravi Kumar rightly pointed out, we have to enforce the act very, very clearly on this man. So
I
that
wonder,
we
but
set
I
the
wonder after all this is over, will the act be, or things will spiral back to what it was? I'm sorry to be sounding cynical, but since the time of COVID, I have done multiple stories about assault on doctors. You're right. Why are doctors being assaulted? Dr. Ravi Kumar, some doctors said it's because government hospitals has a rush, like 6 lakh patients per day, several of them entering. These are people who are very poor. They are not empowered like us, who can read, write, argue, talk. These are emotional people, and therefore these things happen. My whole point is, you can't possibly control people who come visiting the hospital. Only thing is, you can strengthen the security measures. I don't think there are any doctor. I can actually enter, yesterday I was thinking, enter one hospital, government AIMS in Delhi, with a penknife in my bag.
So the security has to be strengthened up, and for which we have been, and the force which is lacking. We don't have enough force, and today also we had an interview, and during the interview, one of the government medical colleges, instead of having 136 security staff, which are actually they are to have it, they have only 36 security staff. So how we can do that? That is one thing. Another thing is overburden. Do you think that a doctor can see 100, 150 patients a day? That is highly ridiculous. It is not possible at all. Humanly, it is not possible. Any human, any labor, you are supposed to work only 8 hours a day. We are made to work near 14 hours, 18 hours a day. And not only that, the resident doctors, duty doctors are made to work for 48 hours together. Is it humanly possible? So such things, naturally you become tired.
Yeah.